Hi everyone, this is Dr. Heather Austin Robillard, and this lecture video is the process of substance abuse evaluation. As you've seen in previous module lecture videos, we will go over how this lecture video will attend to some of the tasks in the ICRC licensing exam for the LCDC. For example, in this lecture video, we will be learning about utilizing interview techniques, assessing and determining the severity level of psychoactive substance use in individuals, selecting and utilizing assessment instrument tools, appropriate screening and assessment tools. Basically, we will be going over the entire domain 1 that was discussed in the readings in the previous module. First, let's look at what a substance abuse evaluation looks like. As you've seen in your required reading, there were 2 case examples of substance abuse evaluation. As you look over these, I want you to think about what are your thoughts about each of these examples. Do you like them? Do you not like them? What did you find interesting about these reports? And what did you interpret from them? For example, if we turn over and look at the Holly Hill Residential Facility, which is Sheila Jones, and we will see the different ASAM dimensions, which we will be talking about in this lecture video. Then the next substance abuse evaluation example is Casey Jones, and you can see this is broken up into different domains that we will also be discussing and will be helpful for you in your first activity. These examples of substance abuse evaluations are not perfect, but they are commonly what is found. And the format may look different depending on the institution or whatever job that it is that you have and what they require. For example, you saw that the Holly Hill or the Sheila Jones example had automated fill-in-the-blanks that needed to be performed on the document. The types of domains and variables you want to evaluate also depends on your institution or your job, or whoever is referring the client for substance abuse evaluation. For example, they may use drug tests on one substance abuse evaluation because it is required by court. Another important component to go over is the difference between a screening tool and an assessment questionnaire. Screening, what is it? The ICRC determines it as a process by which the client is determined appropriate and eligible for admission to a program. These are typically brief procedures, and they determine whether there's a presence of a possible problem. They also substantiate if there is a reason for concern, so like risk factors. They identify a need for further evaluation. So these are typically quick and dirty, and typically tell us that there is need for more information. An assessment or an evaluation is the application of scientific rigor to the gentle art of figuring out what is actually going on before one attempts treatment or to be helpful. We don't want to just throw things at the wall and see what sticks, so we are gathering and integrating psychologically related data for the purpose of making an evaluation. This is accomplished through the use of tools such as tests, interviews, case studies, behavioral observations, and other specifically designed apparatuses like blood pressure or drug tests, anything like that. This is also different from an intake report. The intake report is a type of assessment, but it is typically done when arriving for intake or admission in a treatment facility. It has elements of a substance abuse evaluation or assessment as it relates to treatment. However, it also includes gathering information for administrative functions, such as safety or medical, other information required for maybe like insurance, payment, or legal ramifications. In summary, this graph is something you'll see throughout the semester. Assessment is a problem-solving or question-and-answer exercise. It culminates in the reports that reflect thinking about how we think about the case. For example, what is the question you need to answer? This gives you the purpose for the evaluation. For example, the question that we need to answer is, does this person have a substance use disorder? Then you go to, how do you go about answering the question? What information do you need? And then get that information. So you can get this. We will talk more about how we can gather information in the next lecture video. Then you go about thinking about answering the question. This leads to the interpretation and summary conclusions. What is your answer and what are your recommendations for treatment? The rest of this lecture video will focus on what are the steps or process of a substance abuse evaluation. Now, this may look different for different people, but we're going to kind of talk about the general ideas and philosophies around the process of substance abuse evaluations. Miller et al. In 2011 prescribes it the process looking like this. The first is the screening process. It is likely that the client has a problem, and is there a more thorough evaluation that is necessary? Then the evaluation is the in-depth collection of that information to get a fuller picture of what's going on for this client. Then we diagnose them. Do they have a substance use disorder or do they not? And then what's next? This is where we give our recommendation for what their plan for treatment should be. And we may change it, we may adapt it, we may increase it based off of what was assumed from the beginning. Goldfinger and Pomerantz 2014 shows this as the model of psychological assessment. First, there is a referral. You might receive referrals from a judge or a probation officer, or you might receive referrals from a family member or a doctor, or they might be self-referring them for substance abuse evaluation. Then we analyze the context that the client's in and establish referral questions. What do I need to know before I begin this substance abuse evaluation? Does this substance abuse evaluation determine whether this person goes to jail or not, or gets custody back from their kids? Then we assess the data needs. What types of data do I need to collect? Then we start to gather, score, and interpret the data from the tools and assessment questionnaires that we have gathered. Then after we have interpreted that data, we are going to start to draw conclusions based off of the entire story and communicate our findings to the people that we need to communicate them to, whether that's the client or the insurance company or the probation officer. So basically, again, the assessment is a problem-solving and question and answer exercise that culminates in a report that reflects your thinking about the case. Let's talk about what information do you need to collect. This part will be brief because we will be going over a more in-depth information about this throughout the semester. Remember, in our previous module, we used this diagram to look at how we use the DSM-5 for the medical model. We look at the cause, then we go into the assessment, the symptoms of the addiction, what is the course of this disease or prognosis, and then what is the known treatment that is beneficial for this prognosis. Remember, we saw that there could be multiple different reasons for the cause of this addiction: genetic predisposition, behavior or unhealthy coping skills. There might be a social contextual factor or a personality disorder. And unfortunately, a substance use diagnosis does not really tell us a whole lot about what caused it, what maintains it, and what is exacerbating this disorder, or how we need to reduce it and treat it. And because substance use disorder is a multidimensional issue, the information collected should also be multidimensional. So we're not just looking for information to diagnose the substance use disorder, we're also looking for information about what caused it, what maintains it, what exacerbates it, and how do we reduce it and treat it. In order to adhere to the multidimensional aspect of a substance use disorder and treatment, we could look at the ASM 6 dimensions of multidimensional assessment. The first dimension is acute intoxication or withdrawal potential. The second dimension is biomedical conditions and complications. The third dimension is emotional, behavioral, cognitive conditions and complications. The fourth dimension is the readiness to change. The fifth dimension is relapse, continued use, or continued problem potential. And the sixth dimension is recovery and living environment. You can locate and read more about the American Society Addiction Medicine, which is what these 6 dimensions are from, in the link found in this module. Let's also take a look at how this is used in the Los Angeles County example provided in the handout, the recommended handout. In this tool, you can ask the client questions that are directly related to the ASM dimensions mentioned in this slide. Dimension 1, substance acute intoxication. So you're asking these questions for this client so you can get a better grasp of each one of those dimensions to give you a better understanding of the multidimensional aspect of this client's story. As you see in that Los Angeles County assessment, you can see how each dimension is actually evaluated, which gives you more information about the best placement for treatment. We also want to understand what are the risk ratings for the individual. For example, in this risk rating, we go from low to high. 4 being this rating issues that the client is at their utmost severity and they could possibly have clinical impairments, which means they are possibly even in imminent danger. So we will likely be placing them in a higher level of care. Whereas 0, the rating of 0, indicates that this is a non-issue, they're at a very low risk, the patient presents no current risk and chronic issues most likely are stabilized. Again, this shows us that we do not need to put them in an intense inpatient or residential situation because that would be too invasive for their level of need. Why should I care? Again, knowing their risk rating gives us more information about where we need to recommend them for treatment. You can see here, this is the ASAM continuum of care. Point 5 is prevention or early intervention. Level 1 is outpatient. Level 2 is intensive outpatient or partial hospitalization. Level 3 is residential or inpatient. And level 4 is intensive inpatient or hospitalization. There are several ones in between that, which we can talk about soon. The ASM level of care determination guidelines. This is found in the Los Angeles County one we just discussed. Based off of all of those risk ratings, you can kind of identify how the client answered these questions tells you what the best treatment recommendation is for them and how high a level of care is needed for this client situation. This is the ASM level of care determination guidelines specifically for withdrawal, or physical and emotional ailments, which are the dimensions 1, 2, and 3 of ASM. Because withdrawal impacts can really physically harm a client, we want to make sure that that's a top priority that we're looking into when we're recommending them for treatment, as well as any kind of suicidal or homicidal ideation. ASAM criteria is a good rule of thumb when it comes to placement and also provides good information. However, limited information regarding what to do and what needs to be addressed in therapy or treatment. It also highlights the importance of referral question. Because we are unable to treat or diagnose mental health issues, there is a section in the dimension to kind of screen for that information, so we are getting other professionals involved in that evaluation course. Again, the dimensions of assessment look at all of the information required in a substance use diagnosis. We're looking at the tolerance and withdrawal, the use of pattern, frequency, route, severity. We're looking at the cause or the reason why they use, as well as triggers and potentials for relapse. We're looking at their social support and personal characteristics, as well as any medical, legal, or psychological or relational problems that are inhibited by the substance use. This ends this lecture on the process of substance abuse evaluation. I encourage you to read over all of the handouts and recommended reading, as well as watching any of the recommended videos before you begin Activity 1.